Hi, I'm Dr. Nicole Vane of Moonlight Beach Dental, and I'm really excited to talk about a new product that we have. I've been doing Invisalign for about 14 years, and I can get some phenomenal results. And over the past 14 years, it's gotten clearer, easier to wear, more effective in treatment, and also they really have engineered it well to move the teeth to do really complicated movements that we couldn't have done a decade ago. However, the number one complaint with every single patient I have in Invisalign, and they're usually adults that are wearing it, is that it doesn't go fast enough. They just want to wear their trays as little as possible and get through it as quick as possible, even though it's clear and comfortable to wear. Which of course I understand. I'm just as anxious as they are to see the end results that I know are going to be perfect. So we were selected to be a provider for a product called AcceleDent. I think this is so phenomenal that we don't even sell it at a markup. We literally deliver it to you at the same cost. It's a little expensive. It's about $699 per piece. This piece will last you throughout the entire treatment, and the way it works is it plugs into your USB drive to charge, and you'll go ahead and charge it. Then you'll turn it on. There's a button right here, and you'll wear it in your mouth with your mouth closed for 20 minutes, or you could do it in 4 or 5 minute cycles, 2 10-minute cycles. If you're really ambitious, you could double up per day. So the way Invisalign works is it moves each tooth a maximum of 0.25 or 1/4 millimeter per tray. And each tray is supposed to be worn 14 days for that tooth to move that 1/4 millimeter. With AcceleDent, we can actually cut the tray wearing down to 7 days or even 5 or 3 days per a set of trays, where we can get that same 1/4 millimeter of movement in half or even a fourth of the time. The way it works is the vibrating motion of this mouthpiece that you'll put in over your aligners actually causes the teeth to be engaged more into the aligner, and it stimulates blood flow around the ligaments of each tooth and into the bone surrounding each tooth, causing more osteoblasts and osteoclasts, which are the bone building and unbuilding cells, to move the teeth through the bone faster and actually in a more stable way than if we were just moving it conventionally. If you are a patient who is considering making some changes on their smile, or wondering if you could tolerate wearing conventional braces or Invisalign braces for the length of treatment, but you have an event coming up, say you have a wedding coming up or a big function where you really want to look your best, this can actually accelerate the movement, especially if you're worried about being not very compliant over the course of a year or even 2 years of treatment. You're welcome to come in at any time on any of your cleanings or exams and ask me if you're a candidate for Invisalign or if you're a candidate for AcceleDent.